Hello, my name is Dr. Karen Sun, and I am the founder of the Integrative Wellness Center in Irvine, California. I am a board-certified internal medicine and integrative holistic medicine provider and have been in private practice for over 35 years. Today's topic is SIBO. What is SIBO? SIBO stands for Small Intestine Bacterial Overgrowth. Bacteria exist mostly in the large intestine to ferment the fiber and undigested carbohydrates. Small intestine's function is to digest and absorb the food we eat. When bacteria migrate to the small intestine, it causes fermentation and gas. Gas in the large intestine is easy to get out, but not so in the small intestine. The gas gets trapped and causes abdominal bloating, pain and discomfort. Furthermore, the gas in the small intestine stretches the intestine wall and causes inflammation of the enterocyte, leading to leaky gut. The symptoms of SIBO include gastrointestinal and systemic if leaky gut is involved. So for the most common intestinal symptom is bloating, which gets worse toward the end of the day, belching after meals, abdominal pain or discomfort, constipation or diarrhea, which we call IBS. IBS is actually pretty common. It's estimated about 20% of the population has IBS, and over half of the people who have IBS is due to SIBO. The systemic symptoms can be fatigue, brain fog, weight changes, food intolerance and mood changes such as anxiety or depression. What are body's defense mechanisms against SIBO? First, mechanical. The ileocecal valve is the valve between the large and small intestine. It prevents the backflow. Second, chemical. Our stomach secretes HCl and pepsin to digest protein. Acidic environment kills the bacteria. Third, motility. The intestine cell secretes MMC, migrating motor complex, to make peristalsis, which makes the bowel moves downward. What are the root causes of SIBO? First, food poisoning. It damages the enterocyte and the secretion of MMC. Second, chronic constipation. It slows down the peristalsis. Third, lacking digestive enzyme due to aging, or not making enough HCl due to medication such as PPI. Fourth, use of antibiotics. This causes the imbalance of the good and bad bacteria. We call it dysbiosis. Fifth, stress. It slows down intestine motility and reduces secretion of digestive enzyme. The majority of digestive enzymes are made from pancreas, but small intestine also makes enzymes to digest carbohydrates. Here is a picture of the enterocyte. This is the microvillus we call glycocalyx. Enterocyte make enzymes such as lactose and fructose to digest milk and fruit through the glycocalyx. So when microvilli are damaged, we cannot digest milk or fruit as efficiently anymore, and become lactose and fructose intolerant. When those molecules are not digested, the bacteria use them for their food and cause fermentation. There are 3 types of gas made in patients with SIBO. First, hydrogen. This gas causes diarrhea. Second, methane. This gas causes constipation. Third, hydrogen sulfide. This causes both diarrhea and constipation. The diagnosis of SIBO is through a lactulose breathing test. We ingest a certain amount of lactulose, which normally our body does not digest, but the bacteria in the small intestine can ferment lactulose and produce hydrogen, methane or hydrogen sulfide. We then measure the gas content in our breath to detect the hydrogen and methane. If one or both are present, the diagnosis is made. The treatment plan includes a diet that starves the bacteria, prescription antibiotics or herbal antimicrobials to kill the bacteria and promote intestine motility. This diet is called low FODMAP diet. This means low fermentable, oligo, di, monosaccharides and polyols. Oligo means a few, di means 2, mono means 1, and saccharides means sugar. Monosaccharides are glucose, fructose and galactose. Disaccharides are maltose and sucrose. Polysaccharides are starch, glycogen and cellulose. Polyol is a sugar alcohol such as erythritol. Our body does not absorb this, but the bacteria can use for fermentation. To make this simple, think this as a paleo diet without fruits. So, what is on the menu? Meat, poultry, seafood, egg, green vegetables and herbs. Avoid starch vegetables such as corn, potato or yam. All non-dairy milk without added sugar are okay. All herbs are okay, but be careful about garlic and onion. No grains or legumes. This is a very strict diet, but once the symptoms improve, the food choices will increase, but still stay with the paleo diet most of the time. Studies have shown that antibiotics treatments and herbal antimicrobials have similar results. The choice of antibiotics are rifaximin and neomycin. The most commonly used antimicrobials are berberine, oregano oil and allicin. One major advantage of using herbal antimicrobial versus prescription antibiotics is that SIBO frequently coexists with SIFO. SIFO is small intestine fungal overgrowth, which is candida in the small intestine. The symptom of SIBO and SIFO is similar, except SIFO does not show a positive lactulose breathing test. So when you use herbal antimicrobials, you can treat both, while prescription antibiotics can make SIFO worse. Yeasty Beastie has berberine, oregano oil, caprylic acid and other ingredients to create a hostile environment to inhibit the candida and harmful bacteria growth. Improving motility is very important. Meal spacing, not snacking frequently, can give the intestine enough time to clean up the residual of food and reduce fermentation. Have bowel movement at least once a day. If constipated, take chelated magnesium, which can also help with relaxation and sleep. Smooth Move has herbs to improve the motility and it's very effective. Lastly, I want to talk about prevention of SIBO. The good news is SIBO is treatable. The bad news is chronic SIBO tends to recur. So how can we prevent it from coming back? Eating healthy diet is always important. I am a proponent for paleo diet or Mediterranean diet. Avoid sugar, processed carbohydrates. Eat organic vegetables and small amount of fruits and starchy vegetables. Eat lean grass-fed beef, free-range chicken, eggs, turkey, nuts and seeds. Use coconut oil for cooking. Take digestive enzymes with meal to help digest. Take spore-based probiotics with IgG can help to neutralize bacteria toxins. Spore-based probiotics can survive the harsh stomach acidity. They stay longer in the small intestine to counteract with candida and harmful bacteria. Chew well. Eating slowly will help with digestion. Practice yoga or meditation. This will reduce your stress level and help intestinal tract function better. If you liked this video, please share it with your friends and family, and don't forget to check out our website for more information.